A question that comes up quite often is how often should you be seeing your dentist? And the answer is you should be seeing your dentist at least once a year. Some dentists might want to see you twice a year, but you want to see your dentist once a year. It is very, very important because people who do not have teeth are still susceptible to gum disease, and also your dentist will be able to see if there's any signs of trauma or cancer, which is very important. So it's very important to see your dentist on an annual basis. You can see how your gums are doing. Is there rapid bone loss? Is everything going well? Are your gums nice and pink, or are there any issues that could indicate any kind of concerns that are going on? How does the rest of your mouth look? And just do a basic check. It's very quick, very painless, and it's very important to do. I had my annual dentist visit today, and I'm going to be honest here, I skipped last year. I skipped last year because I had a lot of things going on in my life with my health. Nothing bad, I'm fine, but I just had a lot of things that I had to get through last year. And I didn't think about my dentist appointment. It was the last thing on my mind. In February, I called to make an appointment, and my previous dentist was no longer there. And when I made the appointment, and then I canceled the appointment. I know that's a bad thing, but my anxiety got the better of me. I have extreme dental anxiety, which I think that most people can relate to. And the thought of a new dentist and having to go through all of that was really, really stressful. And I canceled. But I knew it was so important for me to get back on track that I made an appointment. Even though it was a new dentist, it was a new dentist, because the dentist that I had the appointment with in February is no longer with the practice. It's a new dentist. And so that added to it, but I knew I had to make the appointment and go to the appointment, even though a couple of days ago I did consider canceling again because my dental anxiety was really bad. And I had a lot of things going on in my head. And I try to be real when I do these videos, so I'm going to be as honest as possible. I had all these thoughts, like, even though I check my gums every single night when I take my dentures out, I use a flashlight, I check for any signs, anxiety likes to show up to me at 2 o'clock in the morning, 4 o'clock in the morning, and start having conversations. Hey, let's talk. What about this? What if there's that spot you couldn't see, and then you're going to go see the dentist, and your dentist is going to tell you you have cancer in your mouth. Now, I had thyroid cancer, so the fear of cancer is always in my head. So anxiety just ran with it. Oh, what if there's that one spot that you couldn't see and there's an issue? And then I'm going, well, what if you're right? And I almost canceled because that fear got into me. And then anxiety said, new dentists, what if they're not nice? What if they're mean? Like that one dentist in 2002 who told you that your issues that you had going on with your mouth because of undiagnosed cancer was your fault. What if you get a mean dentist like that? And then I thought, well, what if I get a mean dentist like that? And I was really not in a good place. I considered canceling my appointment. That's how bad anxiety, that's what anxiety does. Anxiety likes to get in our mind, get in there and dig and dig and dig. And anxiety was doing a really good job at digging in my brain and making me think about canceling my appointment, but I didn't. Clean bill of health, gums are in great shape. They're nice and pink. I have a great ridge, really great bones. She was really surprised that I've had dentures for 17 years. I said, well, for 17 years, are they in good shape? And her eyes got white. She said, they're in great shape. You obviously take really good care of your dentures. So that made me, or not your dentures, your gums, which made me feel really good because that was one of those things. Anxiety, you were wrong. My gums are in great shape. And there were no signs of cancer, no signs of trauma. Everything is great. I'm glad I went to my appointment today. I know a lot of people who are watching this have anxiety about seeing a dentist. And once you no longer have teeth, you're like, I'm free. I don't ever have to see a dentist again. But you do need to see a dentist. And I thought, while I'm doing this video, I'm going to show off my healthy gums, because one thing that is very important to me is normalizing this part of the journey. Normalizing not having teeth. People may want to judge people who don't have teeth, but you don't know why people don't have teeth. You don't know what brought them to this point. And it's okay that some of us don't have teeth. So here we go. My very healthy gums. As you can see when I show you, I have pretty substantial gums. My ridge is really good, and I have really great bones. So this is my gums. Do. That was my attempt at a drum roll. Nice and pink. A lot of space there. And a really good ridge. The bone on the tongue side of my gum is very thick. I have about that much bone on this side of my gum and about that much bone on this side of my gum. About that much all the way back. So I have a really good, strong bottom gum. And then my top, also in a really good shape. You can see how thick that ridge is. So I'm very fortunate. I didn't have gum disease. Gum disease isn't why I lost my teeth. I lost my teeth because of thyroid cancer, and that caused a deterioration of my teeth. Excuse me. I can't talk really well with my dentures out. They've been out for quite a while, and the longer that my dentures are out, the harder it is for me to talk. But I didn't have any issues as far as gum issues when I lost my teeth 17 years ago when they were all removed. And I've been very fortunate that I have really strong gums and they're in great shape. So I'm really happy. I'm good to go. And my next visit will be next year, and I will not miss it. I won't, if I get a new dentist, if I have to see a new dentist, I will be fine. I will not let dental anxiety set me back again. And hopefully having dental anxiety won't prevent any of you from making sure that you are still seeing your dentist on an annual basis. I'm going to go ahead and go, and I'll talk to you later. Bye.